The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. Thank you very much for joining us for our webinar today. We're going to be talking about the Green Impact Program and potentially how it can be applied in healthcare organisations in Australasia, in Australia and New Zealand. So I'm just going to do a super quick check and make sure, Katie, you can see my screen?
Yeah.
Perfect. Awesome. Okay, so my name is Rhiannon Boyd. I'm the General Manager for Australasian Campuses Towards Sustainability, or ACS for short, for anybody that's unfamiliar with myself or ACS. So I'm going to be doing a bit of an introduction today about who we are and our involvement in the Green Impact Program. And then I'm going to be passing over to Katie, who's with the organisation which is now called Students Organising for Sustainability, or SOS-UK, and that was formerly part of the National Union of Students. But I'm sure Katie will talk a little bit about that transition in a short while. Before we get started, I just want to let everybody know that participants are in listen-only mode, so we can't hear you just yet. We'll go through the presentation and give you some information, and then at the very end there will be an opportunity for questions. So if you have any questions, please do keep hold of them and let us know at the end of the presentation. You can put your questions forward in one of two ways. You can either type them into the questions bar within the GoTo webinar control panel, so you'll see a little section where you can type a question in and then I can read it out on your behalf. If you would like to use your microphone and ask a question directly, you certainly can. You just need to raise your hand. There's a little icon there where you can raise your hand, and I'll be able to see that and unmute your microphone when the time is right. So that was all the technical stuff I think I needed to go through. Yep, fantastic. So just to let you know what we're going to be covering in the session today, I'm going to start off by giving you a bit of an overview of who ACS is as the delivery partner for Green Impact in Australasia. It's really good for you to have an idea about who we are and what we do. And then I'm going to give a little bit of an introduction onto how we actually had this amazing program become available to us. We've been delivering it for 2 years now in Australia and New Zealand. Then I'm going to pass over to Katie, who's going to give you an introduction to the NUS SOS as an organisation and talk more specifically around exactly what Green Impact is and how it can be applied, or how it has been applied in healthcare organisations in the UK. So Katie's got a couple of case studies that she's going to talk through with everybody today. So first off, so ACS, as I said, Australasian Campuses Towards Sustainability, is a not-for-profit organisation. So we aim to inspire, promote and support best practice change towards sustainability across all types of campuses. So traditionally we've been very much focused in the higher and further education sector with the work that we do, but a couple of years ago we broadened our mission to be an organisation that supports all types of campuses, so potentially looking to expand our influence a little bit more into organisations that have campus-like areas. So what we predominantly do within our organisation is we're really good at building cross-sector partnerships. So we bring together sustainability educators, practitioners, change makers to create a community for engagement, capacity building and impact. So as I said, predominantly our membership is made up of universities and some further education organisations. Currently we do represent about 77% of all universities across Australia and New Zealand, and that includes all New Zealand universities at the moment. We've got 100% membership over there. So ACS is really good at creating partnerships with other organisations to bring about sustainability change within our sector. Green Impact has very quickly become a flagship program for us. So in our second year of delivery, we now have 14 universities running the program and doing a really fantastic job with it. So we'll talk a little bit more about that as we go through. some of the other partnerships that we have, which have allowed us to bring some amazing things to Australia and New Zealand, include the Green Gown Awards. So we're the administrative organisation for the Green Gown Awards in Australasia, and we're actually celebrating our 10th year of those awards in 2019. So we've got our, which is coming up in just less than 2 weeks, actually. So they're Sustainability Excellence Awards for the higher education sector. We also have a partnership with our sister organisation in North America, which is ASHE. So I'm going to forget the acronym for ASHE, but it's the Advancement of Sustainability in Higher Education over there. So very similar to ACTS as an organisation. They just work on a much bigger scale than we do, given the size and number of institutions they have in North America. So we've got a partnership with them at the moment, which allows us to support institution using their STARS tool. So the STARS is a sustainability tracking and assessment and rating system. So we've got a cohort of institutions that are piloting STARS for the first time this year, which is another exciting initiative we're working on at the moment. And of course, we're doing a lot of work currently around the Sustainable Development Goals, including a partnership that we have with the SDSN, Australia, New Zealand, Pacific. So we run a regular forum series around the SDGs, around how organisations can map their activities to align with the goals, and looking to progress that further, particularly over the coming years. So just an idea of some of the things that we do as part of ACTS to get a sense of who we are as an organisation. Just in case you're wondering, so I mentioned 14 universities currently running Green Impact Program at the moment. This is who they are. So a really broad spectrum of institutions across Australia and New Zealand running Green Impact, and all doing it in really different ways. So I'm not presenting any particular case studies on these universities today, but if you would like any further information about how the programs have been run and the variances we have in them, then you can certainly let me know, and I'm more than happy to go through that at a later date, or a one-on-one if anybody wants some more information. So as you can probably guess, we did not come up with Green Impact as a concept. It's an amazing program that's been around for a number of years now. So it was founded by the National Union of Students in the UK back in 2006, and it's seen quite an evolution since that time. I'm not going to go too much into the specifics of it, other than to say that we initially started having conversations with NUS around 2014 about bringing the program to Australasia. Unfortunately, due to a number of reasons, it just didn't quite happen a few years ago, so it was put on the back burner. And then the University of Melbourne went ahead and piloted the program, directly supported by the NUS in 2017, and did a really fantastic job of that pilot year that it gave ACTS. It gave us the motivation and momentum to be able to really bring the program fully over to Australia. So last year, we were actually looking for 6 universities to pilot the program to see how we'd go. We got 8, which was phenomenal. And then that's jumped up to 14 universities currently running the program this year, and looking again to expand the number that joins us in 2020. So it just demonstrates really how fantastic this program is, and how easily it can be applied to any type of education institution. And Katie's going to talk a little bit more now about how it can be expanded beyond universities and applied in any type of organisation. So in the Australasian region, Australia and New Zealand, ACTS is the delivery partner for Green Impact, but we are very much supported by SOS as the founder of Green Impact, and make sure that our resources and all the new developments with the program are very closely aligned. So I just wanted to give that background so that we know who ACTS is as the local delivery partner, and then I'm going to pass over to Katie now to talk more about specifically the program itself and how it can be applied. So Katie, over to you.
Great, thank you. Right, so I thought I'd start off as well with a bit of an intro about who we are. So as Rhi said, we were the National Union students and we started Green Impact in 2006. It was actually a student idea who came to us, and we really ran with that idea and made it into the successful programme that it is. We are a student-led organisation, so everything that we do is democratic and is led by students across the UK, and we will respond to what students want. And the climate emergency and climate change is something that students are really passionate about and are concerned about, and that is kind of really informing our sustainability work. So our Green Impact Award then was awarded a UNESCO award for our work in sustainable development. So we were one of 3 laureates to win that award in 2016, which is an incredible accolade and just shows you the incredible programme that Green Impact is. So again, as Rhi said, so on the 1st of October, we actually became SOS-UK, so Students Organising for Sustainability. So we used to be NUS's sustainability team. So we are now 30-day old as a new charity, but continue to lead and are really leaders within the education sector and in the healthcare sector for work on sustainable development within different organisations. So just a bit about our team then. So we have, as you can see here, a whopping 130 years collective experience within our team. See a bit of a team photo there. So we all come together from different sectors. So we have a whole research team. We do a lot of work around food growing and health and well-being, which really informs our Green Impact programme. And we're all practitioners in environmental management. So we're a very experienced team, and we lead our Green Impact programme in the UK and also support, as Rhi said, ACTS and also our European partners to deliver Green Impact within Europe as well. So what is Green Impact then? So we've been talking about it quite a lot, but what actually is it? So Green Impact then is a multi-award winning environmental and sustainability programme. So it's all around supporting staff within your organisations to take action on sustainability, so they feel empowered and inspired to make a change. So it's not a top-down programme where you have managers telling people what to do. It's very much informed by the staff. They know the areas really well. They work in those areas day in, day out. They know their processes, so they know what changes that they can make to make sustainable differences. So that can be anything from sustainability, from around running environmental and like energy saving campaigns, through like turning off equipment, through to looking at your purchasing. So whether you're trying to reduce plastics within hospitals, whether you're trying to look at different ways of working with patients and looking at healthcare, whether that's like opening curtains so they have like more natural light and you're turning off equipment so there's less noise, so it's more quieter for patients, whether that's around like looking at healthy food and the food that patients are given in a hospital. So it really is around staff like thinking of ideas about what they can do, and Green Impact gives them those ideas. We work with all the organisations to create a bespoke programme. So we have 12 healthcare organisations in the UK who are running Green Impact at the moment, and each programme for them is bespoke to that organisation. So Green Impact Reach then, so we work currently within 6 countries. So SOS-UK run Green Impact in the UK, and that's where it's founded and where it started. We don't just work with universities and healthcare, we also work in the arts sector, we work with local councils, and we also work with private sector companies as well. So this is a really bespoke programme and can be applied to many different situations. So over the years, and we've worked with nearly 500 different organisations and worked with thousands of students. They're a real key part to Green Impact. We train students up to be environmental auditors. They go into Green Impact organisations and see what teams have done to try and be sustainable within their areas, and it's a real great learning experience for students to be speaking to staff, to go into the healthcare, to go into hospitals and see what you are doing as organisations to try and make a difference in your sustainability agenda. So we've had over 150,000 people engage with sustainability actions and social justice. And so Green Impact is very much a team-based program where teams are formed across your organisation, and they can be led by real keen and inspired staff. And it doesn't matter what level your staff are at, whether they're junior staff or senior staff, they come together as a team. So Green Impact is very much an equalising project where people come together to work together. And that's one of the great things about it is just getting people who are passionate about something in a room, in a team together, and work together to achieve the aims that we set through Green Impact. So as you can see here, over the last, since 2006, we've had over 375 greening actions that people have completed, and that only increases over the years as Green Impact grows. So this is a couple of stats then from our impact over the years. You can see here like 72% of participants know more about how they can make changes in their daily lives to reduce their impact on the environment. So that's from taking part in Green Impact, they know now more about recycling or energy saving, around sustainable transport or how to save water. It's just informing them to be to know more about sustainability and just those little things that you can do that really do add up to make that difference. So obviously 100% of our lead contacts, so that would be at people at organisations like yourselves, have reported that they've seen those positive changes and improve environmental behaviour amongst their staff. So the staff are trying, coming to them now with actions that they see that they can take. And it's a real great project in you being able to reach out to different areas, especially if you're in an institution that is multi-site. So if you have a lot of different sites, it's a great way of tracking what people are doing. A real great team of people on the ground who are championing sustainability for you, and being able to record those impacts as well within Green Impact, so you can see exactly what people are doing across your different areas. So it's a real great reporting tool as well for you to use for your sustainability aims. So how does Green Impact work then? So you can see here then the cycle of Green Impact. It is an annual cycle. So you would run through this cycle within each year. So the first things first, so I did say that Green Impact is bespoke to every single organisation that we work with. So the first things that we do is we sit down with you. We want to understand how your organisation works. So we try and bring in people from different areas. So whether that's your sustainability team, your waste and recycling, your energy managers, through to your HR team, your communication team. We want to bring in healthcare professionals as well, so doctors or nurses or occupational health, like people who know the area as well and know what actions that staff can take within the different environments across hospitals and healthcare trusts, to really inform what that toolkit looks like. So within each of our healthcare organisations in the UK, their toolkit is completely different. Those organisations is bespoke and people can take actions that they need. So this toolkit then is hosted online, and it has different award levels that people give. So bronze award is very much getting started, quite simple actions to take. So that's turning off equipment, turning off your computers at the end of the day, raising money for charity, promoting cycle to work days. So quite simple actions. Then it goes through to silver and then through to gold award. So that is the top award that your teams can achieve, and that is very much embedding sustainability into everything that they do. So the next step then is team recruitment. So this is where we go out and find those passionate people across the hospitals who are interested in sustainability, who maybe already recycle at home. They might give up meat a couple of days a week because they're conscious of the impact on the environment. Just finding who those people are. So we reach out to them. We do a call to action to people to form sustainability and for people who can be our champions. They go out and form a team. So one thing about Green Impact is it doesn't just need to be just healthcare professionals, so not just your doctors and nurses. It very much can be your cleaning staff, your procurement staff, your admin-based teams, your office-based people. So it can be like ward-based and also offices who do Green Impact. So it really is like a whole healthcare-wide program. It means that anybody can get involved, no matter what you work as or what you do. So then most of the time then is ongoing support. So that is us to, you know, reach out to staff and support them in any way that we can. So we can do webinars, we do newsletters, we can do support calls just to get in touch with those staff and make sure that we are working with them to help complete the tasks that we have set within that Green Impact Toolkit. Then the teams then have a certain amount of time and they submit their toolkit. So they do as much as they can within that allotted time to do the actions in the toolkit, and they press submit. And then the biggest part and real important part is to do those audits, because it's all very well people ticking off things in the toolkit and saying, yes, I'm doing this, I'm trying to save energy, I'm recycling, but we need to actually see that people have actually done these actions, and that is where the audits come in, and that is where your students come in as well. So we recruit students from local universities to do the audits. So they have a training session in the morning, which is completely run by well, ourselves in the UK and RE in Australasia, to train those students up to be an environmental auditor. So as I said at the start, like, such a fab experience for them to be able to go into your hospital environments and see what you're doing to try and be sustainable, and also to be trained up as an environmental auditor. They will then go out and meet your teams and see what you have been doing and see what award level that your team should achieve. Then you have an awards event. So that is where you all come together and really celebrate the fantastic achievements that your staff have done through Green Impact. So you might have seen from the way we speak about Green Impact that it very much is a voluntary scheme for your staff to get involved with. So we want to recognise that achievement, that they've taken the time out of their busy working days to put effort into trying to obtain a sustainability award through Green Impact. So we award them through those awards events. Through the audits then, and through our ongoing support, we are constantly gathering feedback to see how people are enjoying it or not enjoying it, so we can change the programme and fit it around that feedback that we have received from staff. So it's constantly evolving, it's not a static programme. Each year we add in new things, we change things to make it the best possible programme that is for you, your organisation, and for the staff who are taking part. But we've been doing Green Impact now for the last 12 years. We've constantly had fantastic feedback from participants. That's really great. So next then, so Green Impact really does foster that power of the network. So we really want to bring people together and sharing that good practice. So you might have one team who is doing fantastic things, and through Green Impact we find out these initiatives that people put in place. So whether that is they have found a scheme where they can reuse plastic gloves, or they are now using glass containers instead of plastic because they've gone through health and control, and they said that they can use glass instead of plastic for different applications, different uses. So if these people are finding out these ideas, because you know they work within those environments every single day, so they know the changes that they can make to be sustainable, and it's about sharing that through the network through Green Impact, and it just means that people can come together and share those ideas with each other. So we have online resource hubs, as I said before, we can run webinars and events and support calls where we really foster that power of that network. And we really want to see relationships built across your organisations as well, and just for staff to really come together and see that they can, through these small actions, really start making a difference across your organisation. So these are some of our partners then. So it's just a couple to give you a snapshot about who we work with within the UK. So we don't just work with acute hospitals, we also work with mental health specialist trusts. We work with the Royal College of General Practitioners, so that is GP surgeries. We have around 320 GP surgeries across the UK who are currently running Green Impact. And we also work with dental surgeries as well, so a whole team of dentists and their practices are taking part in Green Impact, as well as running across big hospitals as well, across multi-site hospitals as well. One of the cases I'll show in a minute, they actually have a site which has 320 different sites within one trust, and it runs fantastically well across that area. So hopefully you can see from the different organisations that we work with, and the different partners we have as well. So we have partners with the Centre of Sustainable Healthcare, which is another charity who specialises in making hospitals sustainable. We have a very good relationship with them. So it means that we're very informed and knowledgeable about the healthcare sector. And that's just, you can just see here from how it's grown. And not just within those healthcare settings as well, we also work with laboratories to make them sustainable. So if you have a research centre within your hospitals, they can also take part in Green Impact, and we have bespoke toolkits for those set areas as well. So it really does mean that everyone across your organisation, from your health professionals to your scientists to your catering staff to your admin staff, can take part within Green Impact. So these are just some of our accolades then. So we were nominated for an NHS Sustainability Award. So that is our healthcare awards last year for our work with our GP surgeries. So that was a fantastic achievement for us. As I mentioned before, we already won that UNESCO Japan Award in 2016 for our work on sustainable development. And more recently, so we only won this IEMA award 2 weeks ago. So this is a award for our collaboration and consultancy work with a big company on the little island off the bottom of the UK called the Isle of Wight, where we run Green Impact across that whole island with 80 businesses. So these are just some of the awards. So I thought I'd share them with you so you can see how well recognised and how well achieved that Green Impact is within the sector. So these are just some of the organisational benefits that you can achieve through taking part within Green Impact. So it really is that staff engagement tool and bringing in students as well. So it is tested off-the-shelf programme. We have run this, as you saw before, in nearly 500 organisations. We've got those 12 main healthcare organisations in the UK that we run it with, but as I mentioned, that actually is in 320 GP surgeries, around 30 dental surgeries, as well as within hospitals themselves. It doesn't just cover the main areas of sustainability, so it can really cover up a whole different areas, from energy, waste and recycling, your travel plans, whatever your sustainability strategy is, we can shape Green Impact around that, so you are getting out the benefits that you need to report on. Very much around engaging staff, engaging patients, if you've got hospital volunteers as well. And we work with everybody across your hospital and your healthcare organisation to ensure that everybody can take action, because we know that sustainability is such a broad topic. We very much want health to be at the focus of this, and want to ensure that patient health is also at the focus of Green Impact as well. So as I keep on saying, but it definitely just builds team working. It builds that cohesion across your organisation of people working together on one aim or one toolkit to achieve sustainable development. So these are just some of the benefits that you can achieve, but there's many, many more to be had from taking part. So now I'm just going to go through a couple of case studies just to go in a bit more detail at how it's applied at different organisations. So the first one then is this programme that we did with the Royal College of GPs. So this is one where it's actually run at 320 practices now. So this actually came about because we deliver a healthcare module to the University of Bristol medical students. So we do a module with them to show them how, as doctors, so they're trainee doctors, about how they can embed sustainability within their work. So as I said before, we are very knowledgeable around that area of healthcare, and we have been running this module for students for a number of years now. So from that, we did a pilot within a couple of GP surgeries within the UK, and that has completely spread now to these 360 GP surgeries. And it just means that within that area, so GPs are spread across the country, and they're not just within one area. It means that they get a toolkit that they can focus on. It gives them ideas about what they can do within their practices to to really try and be sustainable, and it means that they are part of that network of GP surgeons across the country working on this. So it really gives them that sense of pride and that sense of working together, that as healthcare professionals they are trying to limit their impact on the environment. I'm sure you know there's a lot of research which links air pollution and poor diets can really contribute towards not being a sustainable city or organisation, and this is something that the GPs really work on together to ensure that they are fostering like sustainable lifestyles as well as sustainable development. The next case study then is from our dental programme. So we run Green Impact within dental surgeries. So this again came from a team who run it at the University of Bristol, and they really enjoyed the programme so much that they wanted to bring it into their own practice. So they wanted to inspire dental surgeries across the south of England and train their dental students up to actually take more action on sustainability. So we worked with those dental professionals to come up with a toolkit which was just bespoke to this area of work. So far we've engaged over 50 dental surgeries, which 42 have submitted for an award, and we train students up then to remote audit them. So that means that they actually don't visit them in person. The students audit them online. So they look at evidence that the dental surgeries have uploaded, look at comments, look at pictures to support the actions that are within that Green Impact Toolkit. And the students then look for that toolkit and audit them remotely. So through this programme, we reached 531 staff, and you can see here the award levels that people have achieved. So we've had 12 who have reached the gold standard. So that is the top standard that they could achieve through Green Impact. And just some of the carbon savings as well that you can see at the bottom there, that has been calculated from the actions that people have taken through this toolkit. So that's over 2,185 actions that have been taken by these teams, by these 531 staff members within those dental surgeries. And my final case study I wanted to share with you is because I wanted to share with you one which is a specialist trust. So this trust in Nottingham is a mental health specialist trust. So they have secure wards and non-secure wards. Many of their patients are long-term patients. So it's just a different type of setup to that our normal organisations. So with this organisation as well, they have 360 sites which are spread across the east of England. So whether that is a site which could be occupational health or outreach staff who are based within a different building which isn't actually controlled by the Nottinghamshire Healthcare Trust, or it could be a whole secure ward of patients that are being looked after within this trust. So I wanted to share this one with you to show that Green Impact can be across a whole different types of areas. So we have really worked in Nottinghamshire to ensure that those long-term patients are involved within Green Impact. So the teams that they have within this healthcare trust are formed of staff members, hospital volunteers and their patients. So they're all working together to do the actions that we have set within that Green Impact Toolkit. So it's a real great project for them to get everybody together to work on sustainable development. It really ticks a lot of boxes for them. So they said how it was an equalising project around, it's not just your doctors who work on this, it is everybody who can take part within this programme. And we actually haven't come to an end yet. This is the first year that this trust has taken part, but they're already reached over 65 teams, which is incredible. And we're actually not auditing them until March 2020. But I really wanted to show this one to you, even though it's not come to the end of their cycle yet, but just to show you like the spread that Green Impact can reach. So if you do have really remote sites that you might not travel to, or your staff might be quite remote, it means that they can get involved in something and feel part of that larger organisation that they are part of. So another case of this is from a student who we worked with at UCL Hospital. So this student then worked with us to engage teams within Green Impact, and just shows here just how much students are part of Green Impact and how much they enjoy taking part. It's such a learning experience for them. I can say this because I first got involved in Green Impact when I was at university a number of years ago now, and it actually opened my eyes to a whole different sector for me. I didn't know that environmental auditing or sustainable development was something that I could be employed in, and we see constantly. I've been doing audits across healthcare trusts for the last 3 weeks now, and we've had numerous students volunteering to be auditors for that, and just to see how much they get out of that experience and how much the staff enjoy meeting those students, and for the students to listen to what these staff have been doing, and also for the staff to share what they've been doing. They do incredible work through Green Impact, through labelling their store cupboards and with how much each item costs. So when people go into the store cupboards, they see that this item costs £100, do I really need to use that? So it gets people thinking about the cost of their items. I went to another Green Impact team in a healthcare hospital who was on a stroke ward, and they bring in somebody now who does dancing with their stroke patients to get patients up and moving. So it's a great health and wellbeing program that they've now set up through being part of Green Impact. So there's some fantastic case studies that I could talk about all day that staff have been doing, have been inspired to do through Green Impact. And finally, my last case study then is Anna, who is our partner within Europe, who runs Green Impact within 4 universities within Europe. So you just see here some of the 3 key benefits that they've said that they've seen through Green Impact. So how it can evaluate your environmental performance, and how it can bring people together from different departments and different levels to do something that is a common interest, and how it doesn't just make difference to the environment that you're in, so not just your office or your ward environment, but we see a lot of people taking those actions home as well, because they notice that those small things that they are doing really do add up to make that incredible difference that we see through Green Impact. So that I just wanted to share with you just a couple of case studies, and hopefully that has given you a bit more insight into Green Impact as a programme and how it works. So I'd be really happy now to answer any questions, whether you've typed them into the comment box that we can read out, or if you want to like raise your hand and ask any questions, like now is the time.
Thanks so much, Katie, for taking us through all of that. I hope, I know there's a lot of information there for people to take in, so please don't be afraid to ask any questions now, or if you would like to arrange another time to have a direct catch up, particularly with myself. I want to give a shout out to Katie because it's almost 11 p.m. for her in the UK at the moment, so I really appreciate you coming out for doing this webinar so late in your time zone for us. I do have a question, which is, have you managed to measure carbon reductions? So that's a good question. Katie, do you want to go with that one first?
Yeah, so we have, so within the UK, we have an online tool that is kind of available to everybody to use, called a carbon calculator through the Carbon Trust. So we have been using that tool to look at certain actions in Green Impact that we can measure. It is notably really difficult to measure behaviour change, and we know that. So we have been able to look at a few actions within Green Impact and been able to give an associated carbon saving to that. So most of them is estimates. It's not accurate data because obviously we don't have your energy data, but we're able to give you some suggestion of what carbon reductions that you can see for the actions that people are taking through Green Impact.
And just to add to that, for the Australasian context, we don't have the same online calculator that the UK toolkit does have, but it's something that I'm certainly looking into at the moment because we've got some really fantastic partners that we can work with to come up with a calculator that we can do the same sort of thing within our program. But as Katie said, it's a really interesting one because we don't have access to your baseline data, to your energy metering or all that sort of stuff. So anything that we can provide within this program would be an estimate, and it's a fantastic engagement tool in talking about green impact more generally, but it is not a reporting tool for carbon saving. So just make that really clear from the outset. The next question was, is there a cost to institutions getting green impact to come in and help them? So happy to answer that one. Yes, there is a cost. So when you take on green impact as a program, what you get with it is an entire support package from ACS and from SOS. So we work with organisations through every step of the process that Katie went through. So there's those 6 major milestones with the annual cycle of the program. So we provide, not only do we create the online toolkit as a resource for you, but there are all sorts of things that we do to support you along the way. What the exact cost is for the program will largely depend on your organisation, the number of people that you have. So there's a scalability with costs. To give you ballpark, and this is absolute ballpark, for a large organisation, we'd be looking around $8,000 for the package for the annual cycle. But again, that I would need to get more on your individual program and how that would work as to determine exact costs. Katie, did you want to add anything else to that?
No, just to say, like, it is a very bespoke program, so it really does work. We look at your sustainability strategy, we really work with you to, you know, make sure that what we're reporting on really does, you know, hit your aims as well. There's also like additional add-ons that you can add on as well, if you want more webinars or more support package. As Rhys said, that we really are there like every single step of the way, and we support you through that. And we would, you know, be speaking to you regularly to see how you're getting on and see how we can support you. And as I mentioned, like the toolkit and Green Impact is constantly evolving. So that feedback that we get from people, you know, really improves the program year on year. So you really are getting like a whole bespoke sustainability package for Green Impact.
Awesome, thank you. Next questions, we've got quite a few coming through now. Does the 12-month cycle need to be based on a January-December calendar year? I can take that one. No, we can work within your own timeframes to make it work. So it's really flexible. If you wanted to start your program in the middle of the year, then we could do that as well. So we certainly work with you. The next question was, do you already have any hospitals in New South Wales or Australia interested in getting Green Impact into their workplace? The reason why we ran this webinar today is because we've been getting inquiries about the program and how it could be applied in the healthcare sector. So there is certainly interest. We haven't had anybody sign up for the program yet. One of the things that I'm looking to do is gauge what interest is to run a program with a couple of organisations potentially in 2020, because this is a new area, a new sector that we've moved into. There's a big body of work that ACTS would need to do to be able to support the organisations effectively. So I'm just gauging if there's interest for us to do that. We've been approached by a number of different organisations as well, outside of both education and healthcare, that are very interested in taking the program on. So there's a lot of potential for us to expand very quickly. So that's what we're working on at the moment.
Just to add into that as well, Rhi, if that's all right. So you might have seen as well at SOS-UK, we were not healthcare professionals at all. Like, we're behaviour change experts, and we started off within universities, but we've grown and learned how to work within different sectors. So like, even though we were saying like this is like new to them, and we'll be supporting like acts as well. You've also been taking part now for over 6 years. Just to say, like, we did professionals at all, but we've really grown and learned quite a lot over the last few years about how Green Impact can be applied to different organisations.
Thanks, Katie. I don't know if it was just me. I missed a bit of that response as it cut out a little bit. Okay, I'll keep moving forward. So I've got another question around cost, which I think I've covered. The other element to that question from Chris is the cost based on headcount. There certainly is a tiered pricing based on number of staff that we'd potentially be looking at. So that increases based on, but we're talking in like 1,000 versus 2,000 versus 5,000 staff. So there's a bit of movement in there. A question for Katie. So I know that sustainability has many ways to approach, but I have some specific questions based on product choice. That is, there are two major brands of IV fluid bags, one made in Australia from PVC, made overseas from something else. I need help to work out cradle to grave analysis. Okay, so that's a very specific question there. I might put a pin in that one and we can come back to that one for you, Alison. Is that okay? Next question, are there student auditors being trained here? Is that level of support feasible for a large hospital? Definitely, yes. I've trained 200 student auditors in the past couple of weeks just this year. We've got auditors that have been trained in New South Wales, in Victoria, in Hobart, in New Zealand, in Western Australia, and in Queensland. So definitely yes, and we'll have more as we progress within the program. And the auditors are amazing. They really love being involved and they do such a fantastic job. So, Katie, I don't know if you want to talk any more about the auditors, but it's one of the best parts of the program, I think, in my experience of working with it.
Yeah, no, same. As I said, I was a student auditor at university and it was, what led me into this sector, and they absolutely love it. So it's such a great addition to the program.
We're also seeing some of our auditors from the original program that we ran at the University of Melbourne that have now entered the workforce and are looking to bring green impact into their organisations. Even we've got one student that's looking at introducing it in Dubai, in the United Arab Emirates. Sorry, I probably said that wrong. So it just goes to show you, and we've got a couple of the Uni Melbourne students that were in that first cohort of auditors that are now active sustainability practitioners as well because of their involvement in the program. So it really is a fantastic opportunity for them. A really good question next. How many hours are typically needed to set the program up in the first instance for 1,000 staff organisation? It's a how long is a piece of string kind of question. Katie, do you want to have a go at that one first?
Yeah, sorry if my sound cuts out. Hope you'll hear my response. So it kind of depends on like what you've already got set up. So the first things that we do is like have a chat with your organization already. So do you have sustainability champions? How many staff do you have within your own sustainability team? Is it just one of you? Are there a couple? Just to kind of understand us. Yeah, and then it's like if you've got good links with your communication team, so you know we want to reach out to staff as much as possible, so are those links already there? What we then do is work with you to create the toolkit. So also it depends on how toolkit. Do you want your catering staff involved? Do you want your cleaning staff involved? You know, like it really depends on like what your scope is for the program as well. So yeah, it really depends on kind of what you want. If you just want your healthcare professionals to be involved, then we will just work with you using our existing toolkits that we already have to kind of suggest some actions that people can take. So that'd be quite not as quick to put together. But usually I would say from having like initial conversations, we can usually put like the program together within a month. But it really depends on your scope and what you've currently got within your organisation and how long it kind of gets you to sign it off as well. I know that usually takes quite a while in some organisations. So yeah, I think that was everything.
Great, thank you. I'll keep going through the questions because there's quite a few coming there, and I want to finish up on the hour so we don't cut into people's time too much. So the next question, do you have any audits that show that institutions save money from the changes they make with free impact than the cost of the program? So I think that's like a return on investment type question there. So Again, Katie, you've got a lot more experience within this program. Do you want to have a go at that one first?
Yeah, so at the end of the year, we look at all the actions that participants have taken, and using that tool that I explained before, we then look at the associated cost and carbon savings that have been achieved. So if you've engaged more colleagues within these actions, then we estimate how much we think you've saved. So as I said, we've got a couple of trusts now within the UK, been doing it for the last 6 years, and that is because the savings that we estimate that they save does return on their investment. But as we said, like, we don't want to say that this is a tool for it is a behavior change program, and within some toolkits we have actions, like a whole host of different actions. You might even have like 100 to 200 different actions within the toolkit. I don't want to put that sounds like a huge toolkit. That's just a normal different through the award levels that people work on. So we wouldn't ask people to do like 100 actions within their first year of taking part in Green Impact. But we can't analyze all of those actions because, as we said, that we don't have access to your energy data. If you use renewable energy, how people travel to work, like that data that isn't available to us, but we try and estimate it as best as we possibly can for the resources that we have. And also there's a function within Green Impact for people to self-report. So we have actions around like cycling to work, so we can say how many people have cycled to work, how many people within your department think of an example, turn off like how many computers are turned off at the end of the day, so they can self-report that, and then we can share that with you, and then if you've got your own kind of analysis that you do, you can easily do that from the statistics that we provide. But yeah, we use the Carbon Trust calculator tool within the UK to kind of work out the carbon and cost savings.
Thanks, Katie. Yeah, so the only thing I have to add to that is, again, just to reiterate that the Green Impact, the Behaviour Change and Engagement Program, is what we're seeing the strength of this program, particularly for the Australasian organisations that have been involved. There certainly would be cost savings and carbon savings associated with the program, but we're not going to be able to give those exact figures out of it because it's not that kind of reporting tool. Okay, so I'll keep going. Are the student auditors healthcare professionals, change management, or sustainability? So the student auditors, we recruit them from university. They are a mixture of undergraduate and postgraduate students, and we give that a training session on environmental auditing and what they need to do to assess the actions that are implemented as part of Green Impact. So they're not specifically healthcare professionals or students in medical related studies, but they do have a really good comprehensive understanding of the Green Impact program and how to assess the actions that staff teams have done for the program. Katie, do you want to add anything to that question?
Yeah. Really quickly, so we can also facilitate peer-to-peer audits. I've just done that on last week at a hospital where we had a couple of people who were healthcare professionals who had taken part in Green Impact teams themselves audit other Green Impact teams, which was a really lovely experience because they got to see what others were doing to achieve Green Impact, and also they were learned how to be environmental auditors as well. So there is that option to have peer-to-peer audits as well.
Awesome, thank you. I've got a question which I'm not able to answer myself, so I might need to do a bit of research. Katie, you might be more helpful than me. It's how do you compare? Sorry, let me read that again. How does what you do compare to the global green healthy hospitals in terms of goals and support? So I'm not particularly familiar with the global green healthy hospitals myself. Katie, are you?
No, so I've not come across that, but I'll definitely have a look at it because that sounds really interesting.
Yeah, I'll do a bit of research on that one. So I'm afraid we can't answer that question for you today, but I can get back to you on that one. Okay, so do you run any courses on sustainability? In terms of ACTS, we run professional development sessions throughout the year. We're not a we're not, I'm trying to think of the term, an accredited organisation for running courses. The term's just gone straight out of my head of what that is. We do have professional development that we recruit from within our membership, but in terms of SOS, what do you guys do?
So not professional courses. We're the same as you. We're not like a provider of courses. So the training that we run for the students is approved by the Institute of Environmental Management and Assessment. So this is the IEMA logo that you can see on the screen. I think they're international, so you might have them in Australia. Do you, IEMA?
It's not as big as it is in the UK. Yeah.
Okay. So yeah, it's quite a big professional body in the UK. So they approve our auditor training for the students, which is great for that training and for the students. But otherwise, we run workshops for staff to open their eyes to the different aspects of sustainability. But it wouldn't be like a approved training course. It's very much just a workshop for staff or webinars.
Awesome. I'm going to keep going because we've a couple more questions. I'll try and get through the last couple. I appreciate that some people may have to go, given that we've been an hour, so please do log off. We are recording the session if you want to catch the end of it, if you do need to run off, and we'll just get through these very last couple of questions. So this one is, you mentioned the program is aimed at staff, but we have students and staff embedded in hospitals as part of the local health area partnership. Can students be just as active as staff in Green Impact? Yes, definitely. Definitely. Students have a range of opportunities. They can get involved in teams. If you've got students working in your area, they can be active participants in the program. There's another element which we haven't talked about at all in this particular session, but it's where we actually train up project assistants, which is we train students up at the beginning of the program cycle and give them a background into Green Impact and how it works so that they can get placed with staff teams. So that's something that we do in universities that run the program. Katie, I'm sure you've got a lot more you can say to that as well, but just keep it nice and short because we're running out of time.
Yeah, and not just students as well. So as I said, that in one of those case studies, long-term patients are also involved in Green Impact on the part of teams. And also if you have hospital volunteers, they can also join Green Impact teams as well. It's open to everybody.
Yeah, fantastic. So we've got a comment that's come through saying we're a not-for-profit healthcare organisation. It will be necessary to be able to demonstrate that we will get bang for our dollar when we take up this program. Will you be able to highlight how this will be achieved and by when, i.e. return on investment? So one thing that I'm really interested to learn about is the type of organisations that are interested in Green Impact. It may be that there's opportunities for us to run, not just one organisation takes it on, pays the fee and runs the program. There might be partnerships that we can look at to support a number of different organisations. So if you're interested in this program and you think that you would like to get involved in some way, please do contact me, because there might be other ways that we can get involved other than just you take it on as an individual entity and pay the fee and run the program, which is what Katie was talking about with some of the case studies that she went through earlier. Is that in line with your thinking also, Katie?
Yeah, definitely. So, there's 320 GP surgeries on that Isle of Wight. There's 80 businesses taking part. So it's not just one organisation who pays the fee. You can definitely, if you're in collaboration with other trusts or hospitals that are near you, maybe that's something that you can work together and have it across different sites. That's definitely something we could facilitate.
Yeah, so I'm really, the point of this webinar was to put some information out there around what the program was, how it could be applied, and find out who was interested in taking it on board. And then I'm really keen to see how we can make that work and what opportunities there are. So please do get in contact with me. I'll just quickly flip back to the slide, which has my details on it as well, although hopefully I'll also be sending a follow-up email from everybody that participated today as well. So you'll have my contact details through there. Okay, so one last question before we'll wrap up. It's an interesting one, so I'm certainly not one that I know the answer to. Can we access the auditor training to help build our local programs while the Green Impact program itself is still being piloted in hospitals? That's an interesting question. Katie, have you ever taken the auditor training out and delivered that separate to the program?
Not the auditor training, but some of our other, so the Green Impact Project Assistant training that we just touched on, we have changed that a little bit for different settings. It's definitely something that maybe we could do as like a one-off, like come to your organisation and deliver it. I don't see why not.
I'll just add to that. I think anything's possible. If you've got an idea, get in contact with us and we can discuss it at this point. So I might call an end to the questions now. If you do have any more questions, please do get in touch. My email is up on the screen, but I'll be forwarding details around to everybody that registered to the webinar today. Thank you so much for your time and for your really interesting questions. I'm really excited to see, particularly in the Australasian context, where we can take green impact. We've got the amazing benefit of having NUS/SOS go through over 10 years of development and evolution and continuous improvement with green impact, and we've been able to take it on when it's at its best. So very excited to see how we can take it on in our region and make it work. Katie, did you have any other final comments before I wrap up the session?
No, just thank you so much for your interest. Yeah, just reiterate what Rhi says. It's just a really exciting time to be bringing green impact to your institutions, and yeah, just really excited to see like what we can do and how we can work together. So thank you for your time today, and hope you found it useful.
Fantastic, and thanks again for staying up so late for us.
It's okay.
Enjoy the rest of your evening, and everyone else, I hope you enjoy the rest of your days. I'm sure I'll hear from you shortly from some of you, and send any other questions through to me and I'll get back to you as soon as I can. Thanks, everyone.